Now today, well into the 21st century, medicine is broken. Medicine today can be described as a pill for every ill, where doctors like myself impersonate walking prescription pads. Massive amounts of drugs are being prescribed. Did you know that in Northern Ireland, the average person gets 21 prescriptions every year? Just how sick the population is difficult to comprehend. It's no exaggeration to say that the number of healthy people is vastly outnumbered by the metabolically unwell. The US National Survey examined adults on 5 metabolic health markers and found that only 12% could be considered healthy. And the problem was even worse for the over 60s, with only 2% considered healthy. It's now even predicted that the average child born in America today will not live as long as his or her parents. And one of the major problems with this pill for every ill approach is that drugs are more often used as a band-aid for symptoms rather than to address the root cause of disease. Let's now have a striking look at an example of band-aid medicine, a pill for every ill in action, and it should shock you. It began when this 71-year-old lady was found by her family doctor to have high blood pressure, so she was started on a drug called amlodipine. Now, one of the known side effects of this drug is swelling of the legs, which she of course developed. So 3 weeks later, she attended a cardiologist who, on noting this new development of leg swelling, prescribed 2 diuretic medications, which both cause dehydration. Basically, they make the kidneys excrete extra fluid into the urine. It then just so happened that this lady started urinating a lot. So much so that another 3 weeks later, a urologist diagnosed her with an overactive bladder and prescribed her another drug, fesoterodine, to treat it. This is all true. The problem was this drug caused the side effect of a dry mouth, and so she went back to her family doctor with this new complaint. You know where this is going. And true to form, her family doctor prescribed another drug, anethol trithione, for this new complaint. At this point, this 71-year-old lady was on 17 different drugs, taking them up to 3 times a day, 5 of them having been commenced in rapid succession. And shortly afterwards, she lost her balance and fell, striking her head on a bathtub and fracturing several bones. Now, is it significant that at least 7 of the drugs she was on are associated with an increased risk of falls? Which brings us to the question, are there any reliable surrogate markers related to the diseases of modernity, the conditions which plague us today? And the answer is yes. Insulin resistance. Insulin is a hormone which normally circulates around our body in the bloodstream and is essential for life. But sometimes the insulin we have doesn't work as well as it should, in which case we're said to be insulin resistant. So to compensate for this resistance, our pancreas releases more insulin, resulting in higher levels of insulin, which can easily be detected on blood tests. Insulin resistance has been convincingly shown to be involved in the pathogenesis of many of the top 10 causes of death in Australia today. This study divided subjects into 3 groupings based on their level of insulin resistance and then followed them for 6 years. In those subjects who were the least insulin resistant, on the left, there was not one recorded clinical event over the 6-year period. Contrast this with those with insulin resistance on the right, who from the top down developed cerebrovascular disease or stroke, type 2 diabetes, coronary heart disease, cancer, and hypertension. The results are absolutely striking. And equally striking is this research on obesity, a visible physical indicator of metabolic disease. This study found that the 25% of subjects with the lowest insulin levels shown on the left, had a 2% chance of becoming obese over 8 years. Can you predict what the risk was for the 25% of subjects with the highest insulin levels? 36 times greater at 72%. What are the most important factors that precipitate the development of insulin resistance in the first place? And the answer is, I believe, twofold: fructose-containing sugars and seed oils. Fructose is often referred to as fruit sugar, and it's contained in both table sugar and high fructose corn syrup. Food manufacturers, of course, are expert at hiding sugar in plain sight, and these are all pseudonyms by which sugar goes by. Now, fatty liver was once considered the domain of alcoholics. However, excess fructose consumption, be it from fruit juice or candy, is more than capable of causing this disease, and with it, insulin resistance. I'll say that again. Excess fructose, by way of damaging the liver, causes insulin resistance, which you know is a major cause of modern disease. This study demonstrated the clear impact of fructose on the liver by reducing its consumption. So 41 children with a habitual high fructose intake had their diets manipulated so that the total energy intake remained the same, but the amount of energy from fructose reduced from 12% to 4%. And after just 9 days, median liver fat levels had reduced by 47%. Let me say that again. After just 9 days, the median liver fat had reduced by 47%, which was also accompanied by big improvements in insulin levels.